Welcome to Mid-Michigan Medical Center, Gratiot, a University of Michigan health system. The hospital consists of a 97-bed teaching hospital located in rural Alma, Michigan. The facility is accredited by the Joint Commission and welcomes Alma College nursing students each semester. The facility holds the clinical simulation lab that is used for the portion of the Alma College program. Mid-Michigan Health Gratiot is an up-to-date facility that provides all private rooms within the newly renovated patient tower. Within the hospital setting, the Alma College students get a wide variety of opportunities. The hospital consists of inpatient rehabilitation, medical, surgical, and pediatrics, critical care, obstetrics, mental health, emergency services. The subsidiary specializes in bariatric surgery, wound care, behavioral health, partial day programs, heart and vascular services, pain management, rehabilitation services, oncology, and imaging services. The facility welcomes students to participate in all areas of the hospital and helps with education towards the next generation of nurses. The Simulation Center opened in 2013 after renovating the hospital and building the patient tower. The old critical care unit was turned into the simulation lab. This area allows students, nurses, residents, and doctors to have an area where skills and clinical checkoffs can occur. The area seats around 25 to 30 people, has a smart TV and Wi-Fi for use of presentations, videos, and case studies. Comfortable seating is provided, along with adequate workspace at the tables. The room provides overall good lighting and provides a high-quality area for in-person learning to occur. This area is used by the Alma College nursing students for several didactic classes, along with being used for simulation instruction, preparation, and debriefing. The 8 private rooms are developed to simulate a patient room. Each simulation room consists of a bed, a low-fidelity mannequin, oxygen ports, suction tubing, and canisters, privacy screens, and a hand-washing area. The private rooms are adequate for physical assessment checkoffs, clinical skills practice and checkoffs, along with clinical skills demonstrations. The facility provides all expired supplies from the clinical floor to the simulation lab, which can be used for adequate demonstration and practice for the Alma College students. The simulation specialist is responsible for inventory of supplies, ordering, and organizational upkeep of the laboratory. The IV room is designed to give the students a location that is strictly for IV demonstration and practice. This room consists of adult arms, hands, and pediatric hands to practice IV starts and all IV skills. The equipment has the ability to simulate blood to ensure each student knows when the IVs have been done correctly. The room holds outdated IV supplies provided from the patient floors, along with supplies that the Alma College nursing program has purchased to ensure adequate training is afforded. IV preparation and practice is included within the clinical skills days and open lab times throughout the semester to allow students to further gain confidence in this skill. SimMan 3G is the Laerdal mannequin used for hands-on training and simulation experiences within this facility. This simulator provides adequate opportunities for students to assess heart, lung, and bowel sounds, demonstrate proper pulse points, communicate with the simulated patient, demonstrate proper vital signs, visually see changing vital signs, and demonstrate a response to nursing interventions and actions. The high-fidelity mannequin can be used to run individual student simulations, along with demonstrations and instruction. The computer software has the capability to video each student performance, which is utilized for debriefing after each scenario. The student uses the video to evaluate themselves before meeting with the simulation specialist and clinical instructor for a debriefing session. The software for SimMan 3G was updated in July of 2018. The preventative maintenance was done by Laerdal in August of 2019. Alma College contributes to the cost of the simulator, updates the warranty, and preventative maintenance. Each student participates in an individual simulation evaluation at the end of each semester. This provides an opportunity for the clinical instructor and simulation specialist to evaluate and debrief. The simulation specialist takes the time to keep all high-fidelity mannequins clean, ensure they are working properly, and perform routine maintenance. The simulation control room is designed with one-way mirrors into each high-fidelity room, simulator controls and computers, a microphone, sound system, adequate desk space, and chairs. This room is utilized by the clinical instructors and simulation specialists to evaluate each student and utilize the technology that comes along with the high-fidelity SimMan and SimBaby. The room has the ability to close the door and provide privacy from the simulation classroom. Debriefing can occur in this room as well. Evaluation of each student within the simulation consists of a rubric. The simulation specialist and clinical instructor each follow the rubric during the performance of the student. Notes are taken and a debriefing session occurs between the two faculty before meeting with the student individually. The SimBaby room is a replication of a pediatric room with a crib, the simulator, and the technology that provides vital signs. This simulator can be used for students to assess pediatric lungs, heart, and bowel sounds, vital signs and pulse points, and communicate with a wide variety of pediatric age patients. The room provides a place for scenarios to occur and the students to demonstrate nursing interventions for the pediatric population. SimBaby Laerdal Mannequin was updated in 2019. The costs were covered by the Alma College Nursing Department. This room also includes the capability of videoing the student performance for debriefing purposes.